Every morning, your body communicates with you. The majority of males over 60 totally disregard them. Perhaps you've observed a change, something that used to occur spontaneously, easily, and without conscious thinking. And it doesn't now. It feels different in the mornings. The way your body feels has changed. You question whether this is the way things are right now or if time has just shut a door that you can't open again. Let me tell you, though, that the door isn't locked. What if the key is in your own hands? Allow me to show you a place that most people never visit. Enter the secret realm of your circulatory system, neural system, and body's silent language, because thousands of signals are passing through you as you listen to this. Communications from your brain to your body's most remote parts. And with time, some of those messages have become less loud, a little slower on the walkways. There was a slight delay in the responses. Consider 67-year-old Robert from a small Ohio town. Every morning at 6:15 a.m., he reads the paper and makes his coffee. For years, he would awaken with an inexplicable sense of vibrancy. No more. He told his wife about it once, dismissed it with a laugh, and claimed it was simply aging. Squeezing his hand, she shifted the conversation. They were at a loss for words. His body was communicating with him in its unique language, but neither of them realized it. The language of transformation. The orchestra is your body. Every moment of vitality and every erection are not arbitrary mechanical occurrences. It's a symphony. An electrical signal from your brain travels at an incredible speed down your spinal cord. Your pelvic region's little muscles receive that signal. The directive is straightforward. Unwind. Blood surges in like a river, finding its course when those muscles respond. The tiny veins that would ordinarily allow blood to escape are compressed by two spongy chambers that fill entirely and expand. The blood is stuck. That is the firmness you are familiar with. The liveliness you recall is that. But as the decades go by, this is what occurs. The blood capillaries that supply vitality to every part of your body begin to lose some of their suppleness. Consider a garden hose that has spent too much time in the sun. Not exactly the same, but still functional. The lightning-fast transmissions, the electrical signals from your nerves, they go more slowly. Not in a big way. Enough. A millisecond delay turns into a second. Someone lowered the volume, but the orchestra is still playing. This is the reason why men like Michael, who recently turned 61, James, who is 72, and Robert all observe the same thing. Morning energy wanes. Quieter, but not gone. And the majority of them believe that their only options are to accept it or grab a prescription bottle. However, they are mistaken, because pressure points are thousands of nerve endings that are grouped together like secret switches in very particular places on your body. You can send a wake-up call straight to that orchestra after you know exactly where they are and how to activate them. Your nervous system can be reminded of its proper function. Blood flow that has slowed down can be stimulated. Not with chemicals, not with gadgets. Just a few minutes of silence and your own well-informed touch. I'll show you the first place. Imagine your pelvic region at its foundation, where everything joins the core of your body. It has a little groove that resembles a hinge. Gently move your fingertips toward your body along the underbelly. You'll sense it. A little depression. That's where we'll meet. Your erectile tissue attaches to your pelvis there. Why is this important? Because there is a network of blood vessel junctions and nerve terminals so densely packed in that small area that it functions almost like a control panel. You're doing something amazing when you apply pressure here and massage in calm, purposeful circles. The blood vessels are being instructed to widen. The nerve fibers are being reminded to transport information more effectively. Tissue that has been partly asleep is being roused by you. After seeing her husband David battle with confidence for 2 years, Martha, 63, persuaded him to give it a try. He didn't feel any different over the first week. Perhaps there will be a glimmer of warmth in the neighborhood during the second week. By the third week, he was startled when he awoke one Tuesday morning and turned to face his wife. Something had changed. Noticeably, although not significantly. His body was recalling. This is precisely what you should do. Either lie down or sit comfortably, whatever seems most comfortable. Put your thumb in the base's groove. Use your other fingers to provide gentle support. Put a little pressure on it, firm enough that you can clearly feel contact with the tissue underneath, but never unpleasant. Make slow little circles now. Allow your hand's warmth to radiate. As you touch it, feel the region progressively relax. You could feel a mild heat rising. A little tingle, perhaps. These are very good indicators. They indicate that circulation is starting up. They indicate that sensitivity is coming back. Consistency is the key. Your physique doesn't change all at once. Consider this retraining, similar to physical treatment for tissue that has lost its ability to function. Even 90 seconds every morning. Warmth makes everything better, whether it's in the shower or before you get out of bed. Establish a routine. The pattern will cause your body to react. Let's proceed to the second place now. Most men are unaware that this area is important at all. We refer to it as the perineum. That tiny area of soft tissue that lies between your anus and the base of your scrotum. Discreet, simple to ignore, and vitally important. Why? Because one of the most crucial muscles in your entire pelvic floor is located just beneath that surface. The muscle of the bulbocavernosus. Consider it a valve. This muscle contracts to keep blood inside during an erection, avoiding what medical professionals refer to as venous leakage. The muscle that keeps things firm is this one. It can also lose tone with time, just like any other muscle in your body. It may become lethargic. Erections become weaker and less durable as a result. This is where the beauty lies. Pressing on your perineum involves more than just physical contact. You're reflexively using that muscle. Without even attempting, you're working it out specifically. Think about 70-year-old Frank, an Oregon teacher who is retired. He had been eating healthily, walking daily, and engaging in general exercise. However, he had never considered the muscles that are invisible. During a standard examination, his physician brought up pelvic floor health. Frank began sitting on the side of his bed and applying pressure to his perineum for just 2 minutes each morning. In a few weeks, he became aware that his entire pelvic area was more alive and involved. He began to regain his morning energy in unexpected ways. The method is straightforward but precise. With your legs relaxed and slightly apart, sit or lie down. Put 2 fingers in the middle of your perineum. Your index and middle fingers work best. Firmly but softly press. There should never be any soreness, only definite contact with the muscle underneath. Now, while remaining focused on that location, make slow, regular circles. Go slowly. Allow your consciousness to relax in the space. Warmth may start to radiate toward your pelvic. Perhaps a slight pulsing feeling. These are encouraging indicators. They demonstrate your deep circulation getting better and your pelvic muscles waking up. A good 2 to 3 minutes is enough. Take your time. Allow the stimulus to be absorbed by your body. Here's an added trick that amplifies the impact. Incorporate voluntary pelvic floor contractions into this massage. The movement is familiar to you. It's similar like halting urine in the middle. Hold that muscle for 5 seconds, then relax it. Before or after your perineum massage, do this. There is strong synergy created by the pairing. The tissue is strengthened by the contractions and awakened by the massage. Together, they restore responsiveness and tone. Despite being unseen, the perineum is the unsung hero that keeps you vibrant, especially after the age of 60. The most sensitive part of the male anatomy is most likely the third location. The crown-shaped ridge at the base of your glans is called the corona. You're familiar with it. That little enlargement that forms a ring between the shaft and the glans. Nerve endings are abundant in this area. Their function is to send arousal signals to your spinal cord's erection control center. In essence, you are recalibrating your neurological system when you stimulate the corona with the proper intention and rhythm, increasing its reactivity, aiding in the transition from basic sensory awareness to complete bodily reaction. The important thing to remember is that force and intensity are not the key in this area. It's dexterity. Excessive pressure and speed can overwhelm nerves and reduce effectiveness. Here, mastery is the key term. You're not overflowing, you're awakening. Think about William, 65, an accountant from Minnesota. Although he had read about sensitivity training, he was unsure of its definition. Began spending only 1 minute every morning softly pushing around his corona, alternating pressure with delicate circular strokes. 3 weeks later, he became more sensitive than usual. His body was reacting to any form of stimulation more easily. The brain circuits were recalling their function. This is the suggested method. Using your thumb and index finger on either side of the corona, gently hold yourself. Apply minimal pressure, such as a gentle embrace, as a first step. Hold for roughly 5 seconds, then let go fully. For approximately 1 minute, repeat this pressure release sequence multiple times. This gradually gets the nerves ready. Change to circular massage as the second phase. Make tiny, extremely slow circles around the corona. Gently move your fingers to stimulate the nerves without causing skin irritation. This is a clever alternative. The receptors are awakened by the pressure release. The stimulation of signal transmission is maintained by the circular massage. When together, they help your brain and pelvis communicate more quickly and clearly. This practice gradually heightens your innate sensitivity and promotes stronger morning reactions. Recall that overstimulation is not the aim. Re-educating your nervous system teaches your nerves to react as quickly as they did in the past. The most crucial stage is integration now that you are aware of these 3 sites. Don't think of them as separate tricks. Consider them to be a cohesive ritual. You give yourself a moment. This is the entire regimen that I suggest. A sensible order for optimal efficiency. The foundation groove should be the first. Use regular circular motions to massage for approximately 90 seconds. Your goal is to feel the area become softer and warmer. This is getting ready. Awakening of circulation. To the perineum, proceed. There. Apply light pressure and make controlled circles for approximately 2 minutes. Deep muscle support, the basis of firmness, is being activated here. Put the corona last. Once more, alternate circular massage and pressure release for 2 minutes. Refining nerve transmission is the last step. These 3 steps work in perfect harmony with one another. You start by increasing blood flow. After that, you use muscular assistance. At last, you improve your nervous communication. The 3 foundations of a more dependable physical response are what you're doing. It takes less than 6 minutes to complete the sequence. Let's keep our expectations reasonable. This is not a wand of magic. It takes time for your body to retrain and form new habits because it has its own timetable. Treat yourself with kindness and patience. But after only a few weeks, the majority of men who follow this regimen regularly see positive results. Perhaps the warmth of the morning was stronger than it had been. Firmness that appears to endure a little while longer. Or just a general feeling of vigor coming back to the whole pelvis. Consider 68-year-old Gerald, who had nearly given up. He made a commitment to this morning routine of 6 minutes. First week, nothing noteworthy. He felt heated on the second week. He woke up one morning in week 4 and grinned at the ceiling. His body was communicating with him once more. Not yelling, but talking for sure. By week 8, there was no denying the changes. His self-assurance returned. His vitality increased. He felt like himself again, which strengthened his bond with his wife. Consider synergy for long-term gains. Combine this routine with healthy lifestyle choices to help stabilize these gains over time. Think of these as your most powerful allies. Drink plenty of water. It's crucial to stay hydrated throughout the day. Hydrated blood passes through all of your body's vessels much more readily. Your circulatory system can be compared to a system of rivers. Everything flows effortlessly when there is enough water. Exercises for the pelvic floor. The well-known Kegel exercises. They significantly develop the muscles supporting physical reaction, even if just 1 or 2 minutes are exercised each day. It's a basic motion. Contract as though to cease urinating. Hold on a moment. Let go. Do it again. Do this anywhere, while driving, watching TV, etc. Your muscles will appreciate it. Balanced diet. Give priority to fruits, vegetables, and healthy fats like walnuts or olive oil. Simple, high-quality meals. These produce advantageous circumstances that enhance the benefits of your massage regimen. The odds are in your favor for spontaneous, forceful reactions. Think about the 42-year marriage of Thomas and Eleanor. Thomas is currently 71. He quit attempting to address his waning vitality 3 years ago. Felt ashamed. I felt defeated. One Sunday morning, Eleanor found material about natural techniques and carefully showed it to him. He was willing but doubtful. Began the morning ritual. More walking was added. Increased the amount of water consumed. Reduce your intake of processed foods. They went to the coast for a holiday 6 months later. As they watched the sunset from their hotel room one evening, Eleanor understood Thomas's words when he stated, "I feel like I got part of myself back." It was more than just a physical reaction. It has to do with feeling alive, feeling competent, re-establishing a connection with his own body. The fact is that, regardless of age, your body has a remarkable capacity for regeneration. Sometimes you just need to be reminded. Somebody has to show it the way back. That road consists of these 3 moderate methods. They're not difficult. Neither prescription drugs nor equipment are needed. All they need is your desire to re-establish a connection with yourself over a few peaceful minutes. Imagine experiencing that comforting warmth when you wake up tomorrow morning. You believe that feeling of vitality was a thing of the past. It is still there. It is awaiting. The signal is being awaited by your nervous system. Encouragement is what your circulation needs. Your muscles are just waiting to be used. All the tools you need are in your possession. Your hands, your consciousness, your dedication to your personal health. Morning vigor isn't the only thing at stake. Regaining your confidence is the goal. It's about not accepting that time equates to inevitable decline. It's about realizing that your body still wants to function at its best, at 60, 70, and 80 years old. Still able to react, has more to offer yet. Every tiny action you take to enhance your nutrition, circulation, and muscle tone has advantages that extend well beyond your bedroom. It's your vitality, your happiness in life, your general well-being, which you are developing. You feel important in your life when you feel vital in your body. You feel more present in your relationships, career, and passions when you feel connected to your physical self. At whatever age, you should feel completely alive. You have the right to feel strong and capable when you get up every morning. You have the right to see yourself in the mirror as someone who is taking initiative, refusing to give up, and making the decision to actively participate in his own health. You'll learn something fascinating from the men who have adopted this strategy and integrated it into their everyday routine. They'll tell you that it's evolved beyond a simple physical practice. Their bodies are now having a communication. They deserve a few minutes of silent recognition that they are important, that their health matters, and that their time and attention are worthwhile. Thus, begin tomorrow morning. Or, if you can, get started immediately. Locate that basic groove. Feel the heat rising. Proceed to the perineum. Feel your deep muscles contracting. Make contact with the corona. Observe the nerves becoming more alert. You have 6 minutes of your day. Honor the wisdom and potential of your body for 6 minutes. Keep an eye on the events of the upcoming weeks. Be patient and curious as you observe. Prior to the major changes, take note of the minor ones. The morning sensation has slightly increased. The slightly extended period of stiffness. The overall sense that something is becoming better, coming back, or being remembered. And never forget that your intimate health is a reflection of your overall health. Every constructive adjustment you make has an impact on your entire system. You're working on more than one part of your body. You're maintaining the integrity of your neural system, your heart, your muscles, and your mental wellness. You are making a life choice. Selecting vitality. Selecting oneself. Please take a moment to like this video if this message speaks to you and you find the information useful. Give it to someone who could use it. Post a question or a comment regarding your personal experience. To ensure you don't miss any upcoming information that supports your energy and health at any stage of life, subscribe. More men who need to hear this information can do so thanks to your participation. Men who believe they are no longer vital. Men who should be aware that there is an alternative. You don't have no power. Time is not an obstacle for you. You possess agency, ability, and the extraordinary fortitude of a human body that seeks to recover, function, and flourish. Give it the consideration it desires. Half an hour each morning. Observe how your life changes in both minor and significant ways. Your body is prepared. Are you, is the question.